Hey, everybody. Welcome back to the Speak Up Erika podcast. And in today's episode, I'll be starting a series with my two friends, Cruz and T. Hey.
Hello, hello, hello. What's up?
Yay. So I guess we should start by introducing who both of you are. Whoever, Cruz or T, if you want to go ahead. Yeah.
I'll go first. My name is Cruz. I am 26. I'm currently just working as a freelance photographer and doing other things, such as, bookmaking, just writing, doing all that fun stuff. What else can I say? I'm really bad at introducing myself, actually. Yeah, I would like to call myself a mental health advocate now, just because, it's something serious and I feel like we do need to be talking about this. That's who I am. T, you want to
go? Hi, I'm T. Who am I? I am 22. I just graduated my undergrad in psychology, so I have that background. I'm a mental health advocate. What else? I'm a creative. I'm a student. I'm always learning, always growing. I use many different mediums. For example, painting, cut and sew. What else? What else do I do? I'm also a yoga
teacher. Model as well.
I model. Yep. The list goes on. Yeah, so overall just a very expressive person.
Yeah.
I think that's me in a nutshell.
I fuck with that.
Thanks, you too. Maybe if you'd want, in some of them, I feel like whenever I ask older guests, they already kind of just say, oh yeah, I'm this, and they don't have like trouble saying like who they are. But I feel like for us, when, I don't know, maybe when we're not really into our careers as much, we kind of have trouble saying who we are, or
100%.
Yeah. But if you'd like, could I ask you a fun question? Maybe that can kind of get
started. Yeah, go ahead. Go ahead. Let's go.
Okay, I have drink of choice.
Drink of choice.
Drink of choice. Like I guess I'll start with my drink of choice. My drink of choice, before, I used to do Moscato and white rum mixed together. And then I would chase with the Moscato if it was like
Erika. Every party I would go to that. You have fucked up.
but fun, now my drink of choice is Ryan Ginger, I think.
Ryan Ginger.
Yeah, okay. That shit's bomb. It flows, and you just have like a nice squeeze of the lime.
Ooh. That's like Jameson and ginger ale.
Yeah, that's what it is.
Yeah. Okay, I personally, I don't really drink as much anymore.
Yeah.
But like, I would like a cold, crisp beer. That's basically it.
A specific brand?
I do like Guinness sometimes, but I'll just go for MGD.
Okay.
Yeah. What about you, T?
I love cider.
Like Somersby?
Yeah, Somersby, or what else? Angry Orchid.
I kind of want to drink right now, but I know, right? It's sick.
Cool. I guess that kind of like, I don't know, I feel like asking a fun question kind of helps know more about you without saying like, oh, this is who I am kind of thing. But yeah.
Cool. Thanks for that question.
Yeah. Could I ask one more?
Yeah, go for
it. Well, this one kind of ties into more of like our topic for today. So when you're having a bad day, what do you do to make yourself feel better?
Yeah, that's a good question. I think it really depends on like the mood that I'm in, right? Obviously, for me, I do like to go on drives and just listen to music and smoke cigarettes. But other times I just want to eat a burger. That's usually it. Yeah.
For me, I feel like there's days where I don't want to leave my bed. And that's what will make me feel better, if I literally just stay there. But other days it's like, okay, I'll put on like, you know, my favorite songs or watch like rewatch an old movie. Yeah, things like that.
That's a really tough question though, because it's so situational, right?
Yeah, for sure.
Yeah.
Like each episode, well, I have episodes sometimes, and each of them is completely different. Like sometimes I'll actually use the situation that I'm in to like create more stuff, right? But oftentimes, like I think I mentioned it before, I forgot when, but like say I'm not feeling the certain medium that I'm doing, which is like for me, I make Polaroids and all that stuff. I like to make things with my hands. If I'm not down for that, then I'll switch over to another medium, which would be like music. I'd play music or I'd write. So I tend to like just switch different mediums. I think that's like a really good thing because you could still express yourself, but just in a different form.
Yeah, that's so true. And it depends on like, I guess the severity of the bad day or it's definitely situational.
Yeah.
I think for me, I guess it depends too. Like maybe it's just taking a shower and that kind of just makes me feel better. Or I like how T, you said you just watch like one of your favorite movies. I was actually talking to someone yesterday and they said they said when wait, hold on. They said when the thing they do to make themselves feel better is they watch old cartoons like when they were a kid because it grounds them to a time when they felt that they were normal.
Yeah, that's
Like,
nice.
wow, that's so crazy.
That's really nice.
The other day I watched like That's So Raven and I was freaking dying.
Yeah. Yeah, that's interesting because I was on a Clubhouse chat and we were just talking specifically about film photography and why people do it and why it catches people's eyes. And one of the things that someone mentioned was like, it's that nostalgic feeling. It makes you feel happier to see that photo or even to take that photo with a film camera. So like it brings them back to their childhood when, you know, things weren't all that bad.
Yeah.
So that's
crazy.
Interesting.
Crazy, yeah. I think we'll get into our topic and our first episode. So we're doing this series and it's more about raising mental health awareness, and we're going to be talking about trigger warning, suicide, just like what kind of mental illnesses that we have and things we do to cope and just all of that good juicy stuff. But for this first episode, we kind of wanted to talk more about what mental health means to us and kind of like an intro episode. So woo, I'm so excited. But yeah, I guess, what does mental health mean to both of you? And feel free to, cliche, but should be asked.
Yeah, it's so cliche. It's such a vague question.
Yeah.
But like, again, it's situational. It depends who you're asking, right? But at least for me, mental health is just like literally what it says, mental health. Like, I also read something earlier this morning. It's like mental health is separate from mental illness or disorder. Everyone has mental health, but not everyone has a mental disorder, right? And yeah. And I was like, oh shit, like that's actually very true. But for me, at least, mental health is the biggest thing that I need to take care of. And I think mental health, I feel, is a little more important than my physical well-being because everything comes from the core, for me at least. But yeah, T, if you wanna continue on that.
Yeah.
What does it mean to you?
Mental health is so important. It's so important to do that work and like recognize who you are and the things that the actions that you need to take care of yourself, because we all have trauma. Everybody has trauma. So whether that means it's, having a self-care day or, just making more space for you and really like, getting in there and getting to know yourself better.
100%. Yeah, like the thing that I realized, I think last year was like, man, you really have to take care of you. Like at the end of the day, it's all you,
You
and
come first.
you come
Yeah.
first, and that is such a hard thing to understand. Because like you get into these relationships, you have friends and all that, and then you just end up not thinking about yourself. You don't think about what's on your mind either. A lot of people aren't aware of what's going on in their mind, and mental health is also what's in the mind. It's not only what's in here.
Mhm.
And a lot of people ignore what you're thinking about. And I think you gotta be mindful
Yeah.
of all that stuff. But yeah. Erica, what do you think mental health is for you?
Oof. I've actually never thought about that question until we brought it up just now. So I
Yeah.
guess like mental health to me is just learning more about yourself because as like both of you said, you're I feel like a lot of people kind of push aside who they really are or don't like admit to themselves that they have to like deal with what's up here. So I think it's just like trying to figure out who you are and protecting that mental space and energy.
Mm-hmm.
Yeah, I guess that's kind of what it means to me because I think also it's funny that you brought up like physical health and mental health because all of them are just like intertwined with each other, right?
100%.
If you don't protect your mental health, you can't really do your physical health because like you're not good up there, so how are you going to do your workout kind of thing? You might get
Yeah.
hurt by doing that.
Yeah.
But
And
yeah.
like especially in today's society, because of everything that's going on, fucking COVID and all that shit, your
Yeah.
mental health is compromised. Like everything in here is compromised because you're trying to balance out your life. If you don't have a job, you're trying to balance that out. There's just so much shit that's happening
Mm-hmm.
every day. That shit's compromised.
Yeah,
So
it's very intersectional between literally everything from
yeah.
the school system. Like for example, I wouldn't have like known about my personal disorders and issues without taking an undergrad in psychology.
Oh, yeah, you mentioned
So that education is really, really lacking. Like
yeah.
it goes very far into the system as to
Yeah.
that, to homelessness, to yeah.
It's funny that like you said that unless you wouldn't have taken your undergrad, you wouldn't have known about your disorder. Like I mentioned to T the other day, I was like, yo, I think I have an eating disorder. And like I never would have thought that I would have an eating disorder, right? Because like you see in movies and all that shit, you see people and they're, bulimic and they struggle with all that stuff. But I was even talking to my therapist. I was like, yo, I got an eating disorder. Like, I wouldn't have fucking knew that unless I would have Googled it or like, was curious about what I'm going
Did
through.
your own research and your own
Yeah.
yeah.
It's fucked. It's actually fucked.
It's
Yeah,
crazy.
there's a lot more than what's portrayed. Like, there isn't that much education on BPD, for example. There isn't much education on what other there's so many other disorders. So it's like you only see
there's
the iceberg.
there's different types of disorders too, right? You got personality disorders, you got mood disorders, you got eating disorders, all of that shit.
Yeah.
But yeah, there's a lot. There's a lot that people don't know about, which is again why we're doing this, and this is great.
Yeah.
Some education.
Yeah. I feel like also like talking about I guess like the things that we see in the media too, and that how like we see as someone who's bulimic or anorexic on media, but like they just hyper what is it called? Hyper
They kind of not
you know what I'm trying
they kind of sensationalize it, but they also do
yeah.
it in the wrong way. Like someone with
Yeah.
an eating disorder, they emphasize how skinny they are, like they don't normalize it in a way that someone
That's
looking
the word.
like me, someone looking like me or anyone else could have an eating disorder.
Yeah,
And I think that's crucial. Like the media is one thing. Don't even get me started with that shit. And yes, I'm like us as creatives, we're part of the media as well. But I think it comes to like, are you doing the ethical work that you should be doing? Are you putting out meaningful shit that is sending out a positive message?
Yeah, or even just something as simple as like checking on your people, like, you know, just actually being there for people that, you know, need you. Or let's say, you know, you really never know what anybody else is going through. You will never fully understand what anyone else goes through.
Yeah.
So yeah, just being there for people.
I love how you brought that up, T, because I feel like sometimes we want to just change the world and we want to, you know, like we want to be a superhero and do all these things. But at the end of the day, it's just like making sure you're cultivating the relationships around you and just like building that and growing that. And I think by doing that slowly, that's how you kind of change the world. Right.
For real, yeah. It starts with one person.
Yeah. Oh, love that.
So nice. God.
I know you two were talking about kind of all the disorders. I don't know if you know the answer for it, but what is the difference between like mental health illness, and mental health disorder? I'm not personally like aware what the difference is. I'm not sure if you know.
So like mental illness is the same as mental disorder, but people like to say, so there's different, you know, people have their own definition of what it is. Some people like to say mental illness because, you know, people look at it as an illness. There's something wrong. But on the other hand, some people say disorder because they don't want to label themselves as something, you know, like
as being sick.
Yeah, as being sick. So it really depends. But those are intertwined. Gotcha. Mental health, in general, everyone has mental health. Everyone has physical health. So I guess that's it's like more of a broad term of what.
Yeah, very general.
Yeah.
Makes sense.
So that's the difference. Yeah.
Would you be okay to talk about what mental disorders both of you have?
Yeah.
T, you want to go first or you want me to go first?
So I have ADHD. I also have an OCD, which is a skin picking disorder, and bipolar 1. So I was diagnosed very recently, and I was actually kind of diagnosed with ADHD on accident. Like, basically, I wanted to get, I don't know if I should include this. I wanted to get Adderall for an exam. So I asked one of my friends and she was like, you know what? It's actually easier if you just go get diagnosed with ADHD. They'll give you Adderall and it's just much cheaper. And then whatever. I was like, oh, okay. I'm like, huh. I'm like, well, this kind of sounds like me. And I was like, okay, well, this won't be hard because like this is me.
Yeah.
So my doctor, and yeah, I was like, I think I have ADHD, and he was like, okay. Sat down, asked me a bunch of questions. We went through an assessment, and he was like, yeah, so you have ADHD. There's 2 types, and I have both. So one type is hyperactive, and the other type is inattentive. Yeah, so that's my ADHD story.
What is the difference with both of them?
Yeah.
So hyperactive is like you're hyperactive, like you have so much energy and you can either hyper focus on things or you can what else? It's just like a lot of jumpy energy, like thinking, or yeah, just like
you can't sit still, right?
Yeah, like this whole podcast, I'm sure you're watching, and I'm just like constantly like fidgeting, touching stuff. Like I can't stop moving.
Yeah.
Yeah, so that would be kind of the hyperactive side. The inattentive side is like there are so many things going through my head that I'm not paying attention to whatever's in front of me. I know with ADHD, basically, people with ADHD have lower dopamine receptors. So when I am looking at something or doing an activity, it'll only give me so much dopamine, and then I have to move on to something else.
Ooh,
so it's like really quick, like
yeah, just bursts of whatever. Yeah.
Yep.
You said you have OCD as well.
Yeah, so the OCD is skin picking disorder. So basically, if I'm anxious, or it's kind of like a hyper focus as well. So OCD is obsessive compulsive disorder. So it's kind of like continuous thoughts, or just like an uncontrollable urge.
Right.
It's a compulsion, so an action that you're doing. Yeah, so that I usually will like pick my fingers, or like scabs, or my lips, for example. It right now.
You got the juicy lips.
Yeah,
I'm dead.
But yeah, as a model though, it's kind of hard with my OCD because you can see cuts on my hand, or like my lips are like cut or like chapped. So yeah, it's a little difficult, like trying to navigate. My bipolar, I'm constantly fluctuating. So yeah, it's a little difficult.
Question. I know there's bipolar 1 and bipolar 2. I am still waiting for a re-diagnosis for bipolar 2, but what's 1?
Okay, so I am also going through reassessment right now, but for bipolar 1, basically there's manic episodes and there's depressive episodes. So your manic episodes are euphoria, feelings of like elevated, like increased energy, no need for sleep, like what else? Racing thoughts. So there's some kind of overlap between bipolar and ADHD.
And that's what's tricky about all these mental or mood disorders and personality disorders, is that they all like what I'm hearing from you, like it overlaps with my shit too. That's why I'm thinking, like, should I get re-diagnosed for something else? Like, which is good, because like, there's no one in the world that knows you more than you. So if you're going to the doctors, it's so important to tell them exactly what you're feeling, because they can't guess. And if they diagnose you incorrectly, like, you know what I mean? Like, it's so important to tell your doctor literally everything that you're feeling, because at least that they could do a trial and error test, like, hey, we could do this test for this this disorder. If that's not the case, then we can move on to the next one.
Yeah.
And that's something that I learned as well. So that's interesting.
Thank you, T.
You're welcome.
I guess I'm next. So I have severe depression and anxiety, and I also got diagnosed with BPD just very recently over the summer. A lot of people think BPD is bipolar. I was one of them, but it is not. It is borderline personality disorder, which is a personality disorder. And I'm still learning about it. But one of the main things I learned was it's not treated with medication. It's more so you have to go through something called CBT or DBT therapy, which is dialectical behavioral therapy. And it's more so focusing on mindfulness, and it kind of gives you choices on how to better cope with your feelings.
Mm-hmm.
Yeah, basically, BPD is, there's a lot of symptoms for it. For me, at least, there's every day there's that feeling of emptiness, like I'm going to be abandoned by one of my peers or family members. It could be either or. There's a heavy use of like substance abuse. Uh, what else? There's just a lot of things. I have some notes here. What is it? Intense but short-lived bouts of anger, depression or anxiety. The main thing for BPD as well is that we kind of don't have a sense of identity, which is something that I went through as a kid, and I didn't even fucking know it. Like, I would always be like, yeah, this is who I am. This is who I am. But then I caught myself taking mannerisms from other people and building that into who I am now. So self-image always changes with someone with BPD. Um, yeah, there's a lot of impulsive behaviors, and I guess that ties into bipolar as well. There's just, I think it revolves more around the relationships that you have with people. But that's what BPD is. Depression, anxiety, you know, there's a lot of mood swings with that, anxiety, you know. I've I've only had like a few anxiety attacks recently, and that's something else that I need to learn on as well. But yeah, I'm still waiting for a reassessment for bipolar. But we'll see.
Thanks, Cruz.
I got you. I got you.
Shit.
It's okay.
I was
It's
like,
okay.
I was so into the combo of what you're saying. I was like, oh my goodness, like this is good information. And I'm
yeah.
I caught slipping.
Yeah.
Yeah, I feel like thank you to both of you for sharing with me about like all your disorders and your diagnosis, because like for me, I'm learning about it, and I feel like it's just there's so much that we're not learning, right? It's so crazy because like with doing this, I feel like someone can be like, oh wow, like I'm going through the same thing, maybe I have that, and they can find like learn more about themselves and figure that stuff out, right?
Yeah.
But it's just it's strange that I guess it's because of how mental health was seen in the past, and that's why that there's not like we're still moving slowly up to like learning about all these things, right?
There's a huge stigma, and we talked about it briefly yesterday as well. Like, it all depends on, your background, your surroundings, your peers. Like, even I lost my train of thought, but
how you grew up, like your childhood is going to be a direct relation as to what you are and who you are today. So
yeah, something that I learned, BPD is more so like it stems from something in your childhood. So there's a huge codependency issue with people with BPD, and something that I read on over the summer was it could be like a parent wasn't there for you, and that's where the codependency issues come from. And when I kind of look back on my childhood, I don't blame my parents, but there's they have 4 children. They were so busy working that my siblings would take care of me, or we would just take care of everyone else. And I think with my parents being a little absent, that's where the BPD comes from. And again, I don't blame my parents at all. But it's just the little things that happen in your childhood.
Yeah.
Could trigger a lot of things.
It's crazy how much childhood trauma that you don't realize is affecting you as an adult and as you grow up. And you take a look back after and you're like, oh shit, like, yeah, it really like affected you.
Sorry, I was also I forgot who was I chatting with, but they mentioned that they don't like to use the word trauma, but rather experience. Because if you think about it, for me, my experience wasn't trauma per se, because I didn't even notice that my parents weren't there. It was fine, you know, like we were good kids. But I wouldn't call it a trauma. I'm calling it an experience just because it happened, right?
Yeah.
But with me being a creative specifically, like my mental health, oh my God, like it affects my work so much, to the point where I had to actually, I mentioned this in another podcast, where I had to learn how to say no to clients, the power of saying no, to Lisa.
Power of refusal.
Power of refusal. So it got to the point where I started like comparing myself to other people, and then I kind of transitioned into just doing photography or anything for the money. So when I would start to do client work, it's just like usually I would like take photos of them just in the studio, but it's nothing creative that I like doing. Once I started doing that, I found myself getting into a deeper hole where I was like, what the fuck am I doing? Like I started to get in a downward spiral, and I kind of figured out that, yo, like there's no passion in doing it for the money anymore. So then I just had to I had to start saying no to a lot of people, just so I could just be okay with, again, my creative work and my headspace.
Yeah.
Like that took a lot of mental energy from me.
Yeah. If you got to that point of like acknowledging that, okay, this is not what you want to be doing. This is not what you want to do creatively. And it's great to acknowledge that, and you actually,
Thank you. Like, don't get me wrong, it took me like a few years to even acknowledge that, right? Because you're so stubborn, especially as a creative.
Yeah.
And it's so toxic, the environment that we work in, because you know how it is. Like, it's not only Canada, but it's everywhere else too. Yeah. You just get in the headspace like, I'm not good enough and all that stuff. So really
constant like comparing, and what is he doing? What is she doing? What are they doing? You know?
Yeah. Do you ever feel like that, Erika?
Yeah. Oh gosh. Yes. I feel like for myself, like when you're talking about the power of saying no, I'm so used to if someone says, oh, hey, do you want to do this job? Do you want to do that job? Do you want to be part of this committee and that committee? And then I'm into 10 different things that I'm not even sure if I really want to do. And then I'm crying every single day because of it. And then I'm like, oh my God, there must be something wrong with me. Like, and yeah, I guess in terms of being a creative, I feel like I'm more of a workaholic. Like I don't even know how to
relax.
Yeah. And it's crazy because I've been doing it for years, and I don't know if I'm just obsessed with doing it. Yeah.
Like you're obsessed with the pain, right?
Yeah. Like I want to feel like this, which is kind of fucked up because I don't think I should have to feel like that, right?
Yeah. It's like a never ending cycle. And it's something that I kind of like brought up to my therapist. I was like, this is like an existential cycle where I'm kind of craving the pain. Like, and it goes two ways. Like, my mental disorder kind of helps me be creative, but at the same time, being creative fucks up all the disorders I have. So then you're just like, what the fuck? Right? And you kind of crave that pain all the time. So I mean, I'm still working on it. I don't know the answer to it.
Right. But
it's so easy to get burnt out being a creative and dealing with your mental disorders.
Mm-hmm.
T, how do you like, what are some of the things that kind of help you like deal with all that burnout and shit?
Well, okay, so with the bipolar, I'm very up and down. Especially recently, I've been like, some days I'm manic, some days I'm just in a depressive episode. So, and then there's days where I'm mixed. So it's just a constant like wave. But when I'm manic, the shit I can get done, I'm just like a fucking machine. Like I'm constantly doing stuff. Whether that means I'm like cleaning my room, like it's because it's definitely right after a depressive episode and then I'm manic and I'm just like, I need to clean my life. Like yeah, and I'm usually more creative when I'm manic because I don't know, I just have like the energy and the time to put into whatever I'm doing. So yeah, I don't if I'm in a depressive episode, the only like real creating I'll probably do is like uh I don't know, some rough sketches if I'm like in bed. But yeah.
Could I ask you to, I know you both were talking about how you got diagnosed and stuff. How did you, I guess, have the courage to get the like go to the doctor and like go through that? Because I feel like for myself, I personally haven't been diagnosed, but at the same time, I don't know, not that something's wrong with me, but I'm like still trying to figure out myself.
Mm-hmm.
And I've like spoken to, like yesterday, I spoke to a counselor, or I've been taking therapy, and they kind of, oh, let's do this direction because it seems that you have more depressive symptoms. I guess not necessarily I have a depressive disorder or something, but yeah, I guess I'm rambling now, but yeah.
No, that's okay. Good for you for like, you know, you're taking the time to really understand yourself. So
Thanks.
Props to that.
Yeah.
The first thing is acknowledging how you feel. So
oh,
it's very
thanks.
good. And accepting it. So that's very good.
Mm-hmm. But how did you two have the courage to go to your doctors to, I guess, get a diagnosis?
Mm-hmm.
If you don't mind sharing.
No, yeah. For me, like I didn't get diagnosed until I was in university. So that was when I was going through my psychology courses and being like, oh, okay, putting two and two together here. But also, so having that background really pushed me to do that. And also, my older brother, he also has bipolar. So just knowing that like other family members have it, with bipolar, it's more likely that if a parent or sibling, someone who's like really close knit, has it, you might also have it. So that was something where I was like, okay.
Right.
Yeah. So
yeah.
a bunch of little things. And I was like, yeah.
Yeah. It all has like a lot of it has to do with genetics as well, right? As well with like having your experiences and stuff. It all kind of ties in together. Mm-hmm. Yeah.
For me, so I went through a really, really, really toxic and abusive relationship. This was in university, or actually, it was like, I don't remember. I think I was in university.
Uni was so long ago for us.
Dog, we're old, man. Fuck, I can't even remember anymore. What happened? Oh, it was like, I think it was like a 3-year relationship, but it was terrible. And I had gotten to, so this was before the diagnosis. I was abusing a lot of substances. And, I was fucking having fun. I was like 20, whatever. I didn't know what the fuck was going on. And like, I thought I loved this person and all that shit. But a lot of toxic stuff was happening. And, I kind of had that imposter syndrome. I was like, oh, everything's fine or whatever. It wasn't until I got into like a really, really, really bad spiral. I didn't really know what was happening. And I had tried to commit suicide one night. And I knew something was wrong, but I was in biggest denial ever. And I thought that what I was feeling was guilt because I haven't I wasn't out yet, right? So I was like, okay, like a couple weeks passed by, I'm still feeling this, I should come out. So I fucking came out like during Thanksgiving or some shit, and it just got fucking worse. I thought that was like the end of it. And I kept abusing, kept going out, kept drinking, whatever. Um, and I was also overworking myself. I was juggling three jobs while going to university, right? And I was trying to distract myself with all that stuff, but eventually, like when I got to my lowest point, I just went to my family doctor and I was like, "Yo, listen, like I think I'm depressed or whatever." So she did tests and stuff, and yeah, she diagnosed me with severe depression and anxiety. And with not OCD, sorry, with BPD, again, I went through another traumatic relationship just very recently. And I think I got to the point where I was like, there's so much going on with me, and I'm not even scared to get diagnosed anymore just because I want to be better and I want to feel better. So I like immediately just like called up the same family doctor. I was like, yo, I think there's more shit wrong with me. And again, I relapsed, right? I started doing drugs again, and that I went to another spiral. And that's when I was like, yo, I got to figure out what's going on in my head. So that's how I got into being diagnosed and all that stuff. It's fucking tough being diagnosed. Like I was embarrassed the first time, and I had to hide it from my parents. I don't even know how long I hid it from them. And even like taking medication and shit, like even telling my parents, I didn't talk to them for like a few months or something, And coming out, I was like, yo, this is so much.
Too much.
A lot.
So yeah. But we're getting there. Thank you for that question, though.
Thank you so much for sharing.
Make me cry.
Like, I'm here crying.
I was gonna cry.
I'm actually here crying. Oh God! Thank you so much. I mean, Cruz. Thank you so much. Jesus, I mean, the edit is gonna be like Cruz. You know how like
the voiceover.
Like, yeah. Thank you so much, Cruz.
That's so funny. Yeah, I could go on and on, but I don't want to make you cry.
Oh no, I'm enjoying it. It. Man. Like the release is so good, right?
Yeah, 100%. Yeah.
I think the worst one is when you cry and then you just can't stop crying. The ugly cry. Yeah, I went through that the other day, and it was the first time that I was able to stop it. Was by counting to 10 until I was able to like not like that quivering thing. So that was like the very first time I was able to control it, because usually I would just the whole day is just me crying until like I wake up the next day and I look like I got boxed in the face kind of.
I know those ones.
I actually, that happened to me one time, and I went to work because I had to go to work the next morning, and my boss was like, yo, like what's with your face? I'm like, allergies, like I had an allergic reaction.
Bro.
What am I gonna say to him? Like, I've been crying all night, that's why my face is fucked up, right?
Honestly, like sometimes I fucking say it. Like I'll have and T knows this all the time. I've had like, so I have one-on-ones every other week with my manager, right? And now it's over Google Chat, whatever.
Yeah.
For some reason I just fucking end up crying, and then like in the morning I end up crying, and I have a meeting at like 12 or something, and I'll just like message her. I'm like, I'm so sorry, my face is fucking wrecked. She's like, you okay? I'm like, nope, just cried. She's like, okay, I hope you feel better. Like sometimes it's like, it's just better to like just say it. But at the same time, if you're a fucking manager and saying what's wrong with your face, like, bro, you just gotta be respectful.
We had a weird relationship where like I'm afraid of spiders, and he would put a spider in a jar and be like, yo, Erika, look what I got for you. And I'm like, I don't want to be here.
No, that is not good.
Anyways, I digress on that.
Oh man. You know when you like get into that crying thing, it feels good at the same time though. But something that helps me at least is like to do 10 push-ups. So at least you're kind of breathing at the same time. You're being mindful of how you're breathing. Yeah. And you're getting a little workout too.
Yeah. Interesting. I might think about that one.
Maybe try it.
Yeah, I might try it. I feel like sometimes you feel frozen too though. That like, you know, like I feel like when I get into one of those states, I just like I have my eyes closed for the whole entire time and I'm just like, okay. But it's kind of hard because then when you're just kind of frozen and sitting with those thoughts, and then those thoughts is what's making me uncontrollably cry, right?
Yeah.
So it's this
is the thing that I've learned in DBT so far is that like, yeah, those intrusive thoughts are there, but they give you a choice whether or not you want to continue and get hooked by those thoughts or you want to get unhooked.
That's true.
So I think they think that in CBT as well. But
the repetitive negative thoughts.
Oh God, yeah. Fuck. But we're in this together.
Yes. Oh my gosh, first episode I cried. I can't wait. It's gonna be good.
Yo, low key, my goal was to make you cry the first episode.
Wow. True.
Nice.
Mission accomplished. So thank you so much, Cruz and T, for sharing about both of your mental health journeys. I think that we really, as our first episode, I learned so much, and I learned so much about both of you. I really appreciate both of you.
I appreciate you.
Oh my gosh, I'm gonna cry again.
It's okay.
But would you like to share a bit about like drop your what your businesses are, or like how we can support you as creatives? Because I know like being a creative is just, we want to just all support each other. So if you want to say, shout out your stuff.
Cruz, go ahead.
Okay. You can find me on Instagram. It's at VMIVC. I'm doing some cool art shit over there and also trying to get into writing. I'm also a co-host for the Strong Ties podcast. So you could catch us on YouTube, on Deezer, Apple, Spotify, and the handle is Creating Strong Ties. And we also talk about mental health there as well. So take a look.
Yeah.
Lovely. Yeah, podcasts are so funny.
Oh, did you guys watch the one yesterday yet?
Not yet. I'm gonna watch it.
Okay. Watch that.
I'll message you, Cruz.
Okay, I heard that.
T, for yourself?
Yeah, I'm on Instagram at it's BBT. I model, music video shoots, photo shoots, anything.
Yoga.
I'm a yoga instructor. My yoga studio is at Yoga Space. What else do I do?
Loose Fade.
Check out Loose Fade, my little thrift store. At Loose Fade on Instagram and Depop. What else we got? I think that's pretty much it right now.
Ooh. For now. This girl said for now.
I love it. Awesome. And stay tuned for the rest of our series. We got a lot of stuff for you all. Next episode that we have is experience in the healthcare system.
Yeah. Plus more.
I was like, wait, what is it again? Experience in the healthcare system is what we're planning to talk about in the next episode. And yeah, as Cruz said, plus more.
Juicy stuff.
Juicy.
Yeah.
Thank you, Erika.
Thank you, T. Thank you, Cruz. Thank you for everyone listening. Bye.